Greetings, bastard BAS. This is HM1 Tadzak coming from you on the other side of the internet with this digital training. It's going to be on COVID-19 triage. This is going to just be to hopefully clarify some issues that continue to happen, and everybody will hopefully be on the same page with this during all this craziness. So, we're going to go over the terminology. We're not going to get too into the weeds on this one. So, I'm sure everybody's already familiar with restriction of movement, otherwise known as ROMs, patient under investigation, PUIs, and then confirmed COVID-19 cases, as well as RTW, which is return to work. Now, from my understanding, what seems to be happening is there's sometimes a little bit of a miscommunication on where someone falls into the ROM/PUI category, which is hopefully what we're going to be talking about in the next couple of slides here. Really comes down to pretty easy categories as far as you fall either into column A or column B. Okay. So, in regards to return to work, the thing that we're concerned with is obviously that first factor, which is if you've traveled to an area that is what they deem level 2 or 3 of COVID-19 areas of risk. If you look at this map, which I just pulled off the CDC's website, you can look at those bottom three colors, dark red, orange, red, and then orange. That's essentially the colors that you're going to be looking at. Now, this gets updated daily, so it would behoove you to actually try and go onto this website and make sure we have a daily tasker, or if someone wants to actually take the initiative and push this information out, that would be great too. So these are the places that you want to keep an eye on, that if you hear Marines talking that, hey, they had family come and visit them from Florida or Alabama, it's one of those things that should be concerning because one, they really shouldn't be having visitors like that right now, but we can't control everything, right? And two, the other thing is, well, there's a good possibility that they may have just transmitted COVID-19 to the service member that they were visiting. The other thing that we're looking at is obviously international travel, which none of us should be doing, but on the off chance that somehow people slip through the cracks, or like I just said before, it gets to the grapevine that they had someone come and visit them from one of these endemic areas, you just need to be aware of that in general. They have the same map for a global scale. All right, going back to restriction of movement, our ROM people. So there's two things that can only really classify someone for ROM. Either they come from one of those level 3 or level 2 areas from traveling, or they come in close contact with a confirmed COVID case. Emphasis on confirmed, okay? That is how you get into the ROM category, okay? And the precaution for treatment here is it's the standard return to work after 14 days, assuming that they're exhibiting zero signs and symptoms, and they should be good to go and get medically cleared to go back, assuming nothing's wrong. Now, there isn't a official category called MROM, but I'm just doing this for the sake of this training to try and create a little bit of clarity, okay? So MROM is what I'm going to call it, right? Remember, this is not a technical term, but MROM is a maybe restriction of movement, aka someone who's quarantined in regards to, for example, a roommate of someone who's a PUI, pending person under investigation. So they haven't really fully qualified for the ROM status of being quarantined for that full 14 days, but it's more of like an enhanced SIQ where we're going to treat them as ROM, okay, until we get the test results back. Once those test results come back, either it's affirmative, yep, they're going to go into full blown ROM status because they were exposed to that person who is COVID-19 positive, or they, assuming they're not exhibiting any signs or symptoms, will be cleared to return to work, okay? And they don't need to be isolated for those 14 days. All right, so that's what that quarantine means. Here's an example of what Naval Hospital Camp Pendleton's giving out for those quarantine forms. And this is maybe where some of the confusion comes in, is because on this form it just says quarantine form, and it does say 14 days of pretty much exposure, or not, excuse me, not exposure, but uh, staying in quarantine for 14 days. All right. Now, this is just kind of the precursor to cover them, depending on however long it takes for that test result to come back, if they have to investigate it more for whatever reason. So it just gives them extra time, okay? It doesn't mean they're really wrong, all right? It just means that they're quarantined until they actually get the clearance from the test results of whoever they came in contact with for COVID-19, all right? Now, person under investigation, PUIs. These are the people who are actually getting tested for COVID-19. Either they've gotten the swab or the swab isn't available and it's a physician that is doing an in-depth evaluation on their assessment and making the call that due to the signs and symptoms that they're presenting, that more than likely, yeah, maybe they are COVID positive, okay? These individuals cannot return to work until they are medically cleared. What that means is either the test results come back negative or after 72 hours, they're not exhibiting any more signs and symptoms, and then it's a 7-day period after that that they have to wait until they actually can get cleared by a medical professional and hopefully get the good graces to go back to return to work. The example here on the screen is similar to that pink form that we saw. This is once again from Naval Hospital Camp Pendleton. It's an orange form. It's the isolation form. This is the strict form, okay? This is like, yep, we think you have COVID-19 or maybe you do have COVID-19, but this is the form that you're going to post so everybody understands before they go accidentally walking into a room and exposing themselves unnecessarily that it will be posted and this is what people are going to give their commands and it's used for patient tracking and all that other stuff. Well, hopefully brought a little bit of clarity in this, and I don't have any questions because I can't answer them right now. I didn't go too quick. I have faith that all of you can follow along with this, and you've been dealing with it more than I have over there. So we'll just do some quick scenarios. There are going to be 3 of them. So first scenario, part 1, all right? So in this scenario, we've got Lance Corporal, who becomes a person under investigation because he's presenting sign or symptoms because he goes to Doc and he says, "Hey Doc, I'm not feeling too good. I feel shortness of breath, excuse me, blah 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 blah." And the corpsman says, "You know what? I'll talk to our provider and we'll go from there, okay?" So they end up sending him down to the hospital, gets tested, he gets put on that PY status in the meantime because he's pending that test result. Well, obviously, he's a Lance Corporal and he doesn't live alone. He lives with the corporal, right? So now his buddy that lives in his room, or maybe it's not his buddy, it's just his roommate that he hates, but regardless, he's got to let this person know and the command know that he's pending COVID-19 status. And this also goes on like onus on the corpsman, like push people. Don't just assume that they're going to follow through on this, that they have to follow up and say, yeah, my roommate's exposed. He's going to have to get put on that modified quarantine, okay? They're not full-blown ROM yet, but at the same time, we're going to treat them as such for that maybe potentially 3 to 4 days while we're pending the test result to come back. All right, does that make sense? So just to recap, we got a Marine, went and saw their corpsman, presented enough signs and symptoms that the corpsman and the provider were in agreement to send him down to the hospital to go get tested, and they're pending testing. And now he is in isolation, and his roommate is now on a modified ROM slash. It's actually a quarantine status. They're not ROM. They're really just quarantined. They're pending ROM. All right. Scenario 1. All right. Ending 1. So in this scenario, what happens is that test results come back negative. All right. He can go on his happy little way. Doesn't have anything to worry about it. He's returned to work with no symptoms. Same thing for the corporal. All right. He can actually be free to go back to it and they'll probably talk a lot of mad crap to each other about what just happened. And corpsman get a back pat for all the good work that they did, yada, yada, yada. All right. NAM's in the mail. Scenario 1, ending 2. All right, here we go. So going back to part 1, pending results, we've got the Lance Corporal that's pending person under investigation, okay, PUI. And then we've got the corporal, his roommate, that's in ROM status, okay? Test results come back. Well, got some bad news. It's positive, right? So he's COVID 19 positive. This goes into full blown isolation for that individual, and they will not be cleared until they no longer present symptoms for a period where it's been no longer a fever and it's got that 7 days with no symptoms, or they have two negative COVID tests with a greater than 24-hour time span in between the two tests. Okay, so what does that mean? Well, sucks to be the corporal, right? That just means he is officially in ROM status. Now he is in ROM status, okay? Restricted of movement because his roommate tested positive, and per that criteria of ROM, okay, he didn't travel to any level 2 or level 3 areas, but he did have close contact with a positive COVID 19 patient. So he is actually in that status. Well, wait a minute. Surprise! Corpsmen, obviously, they don't have their FMF pin, so they don't know what to do, and they didn't follow proper PPE procedures, and they're morons, okay? They just exposed themselves as well to that patient without following the proper protocol, and now they're on ROM as well. As you can see in that last scenario, it can really easily like spread like wildfire. If like somebody comes back positive and we don't take the time to actually do the correct things and slow down for a second, this is basic core school stuff. You know what I mean? This goes back to protecting your surgical field. Okay, I have the confidence that all of you understand the concepts of how to properly don gloves and a mask. Okay, so all right, now moving on. Scenario 2, part 1. In this scenario, we've got somebody, which is Sergeant Pepe, who, well, he broke the liberty policy and he went out of state on leave to go visit his family in Florida, okay, which is a level 3 risk. Well, he comes back and we find out, and it's not just us that finds out, it's Sergeant Major that finds out, right? So he flips out, causes a big old problem, but in reality, he just meant ROM status, okay? So we put him on ROM status, and he gets put on ROM status, and we're going to move into scenario 2, ending 1, okay? Now in this one, what's going to happen is he's in that isolation for 14 days, and everything's fine, you know? He doesn't end up presenting any signs or symptoms, and he's good to return to work after getting medically cleared after the 14 days of isolation. Okay. He's probably going to get NJP'd, so life isn't going to be that great, but at least he doesn't have COVID 19. Scenario 2, ending 2. Okay, so he's in that ROM status. Well, within that ROM status, he starts not to feel well, starts to present some signs and symptoms, feverish, feels shortness of breath. Doctor decides, you know what, let's send him down to go get tested. Gets tested. Turns out, yep, he's COVID 19 positive, right? So at this point, not only is he going to get NJP'd, but hopefully his medical condition doesn't deteriorate to the point that he ends up on a ventilator, all right? Dumb decisions in life equal dumb results. All right, scenario 3. This is going to be a 4-part ending, so stay with me. The background of this one is we've got a service member who had authorization to travel overseas for whatever reason to go visit family. Okay. Whether it was the Liberty policy changed while they were already on leave, so it was a little late for that, or they had a special circumstance. But regardless, that's the scenario. We've got someone that is coming back from overseas. Okay. So this person comes back from overseas, and the build up to this one is over the flight. the country they just left ends up turning to a level 2, okay? So, based off that, when they land, they're going to automatically be put into that ROM status because even though it wasn't a 2 when they were physically in the country, before they even touched ground in the US, bam, they got that welcome home aboard with, yeah, you got to go into isolation for 14 days because that country has such an uptick in COVID cases, okay? So, within this scenario, he's in isolation and signs and symptoms start to deteriorate and they do a COVID test and, well, turns out he is positive. Well, that sucks, all right? So, moves into the isolation procedures and treating that individual for the COVID-19 at that point. Hopefully they pull through. Now, scenario 3. Okay, we're going to back up. They're back in the same situation. Okay, they got that welcome home. Hey, yeah, country you were just in changed to a level 2 status. Okay, level 2 status. With that being said, they're on ROM. So they're on ROM. 14 days pass. And just like Sergeant Pepe when he was fine, they're fine to return to work as well. Okay, now, scenario 3. We're going to erase the whole country. Okay, I know I'm messing with your mind here, but the whole country is no longer level 2. This time, they made it from point A to point B. Country is completely fine. No worries. However, he gets a phone call from that family member that says, hey, so and so just tested positive for COVID-19. Um, you were staying at our house the whole time. You guys should be careful, okay? Well, service member finds out, does a diligent thing, reports to the command, put them on ROM because he was exposed to a positive COVID-19 patient, okay? Meeting that criteria for ROM. Now, with that being said, during this scenario, 14 days passes and they're fine. Okay. And same scenario, backing up here, is where they have that family member call that they just visited and they say, hey, um, we've got some COVID-19 family members here that are truly positive. We're worried about you. Please take care of yourself. So in this case, they're on that ROM. They start to develop signs and symptoms, right? So medical decides, you know what, let's test them to be safe. And sure enough, unfortunately, COVID-19 positive, okay? Now, hopefully, even these scenarios help just as silly as they were, okay? They're pretty basic scenarios, but at the same time, uh, that's kind of what you guys are going to run into. We've already had a couple incidences here in the command where some similar things played out. Basically, what we have to do is just try and keep our cool and follow the chain for how these patients need to get treated and how to isolate them. Where it gets tricky is when we have that interim status of someone not being officially ROM, but the person that they were around is a PUI, okay, because they're waiting for their test results to come back. So, with that being said, those are that's the gray area here. It's the in-betweeners. Those are the people we got to pay attention to. And the scary thing is sometimes it may end up being like how many people that person was exposed to and how close of interaction they had that we may need to take note just to be on the safe side. Okay, it's just in case that test result, comes back positive. We can start doing that custody of patient contact and see where it takes us. Okay, so you know, like this quote says, hang on to your hat, hang on to your hope, and wind the clock because tomorrow is just another day. Uh, I added just another day, but how I take that is we really don't know when this is going to end. From the sounds of it, it sounds like it's just ramping up. So please just keep doing what you're doing, do your due diligence. We'll get through this and take it a day at a time. That's all we can do. And keep yourself safe and be smart, all right? So tune in. There's going to be more of these throughout the week. Hopefully this one was the first one and they'll improve throughout the week. So bear with me, y'all, and we'll put some hopefully some quality training in there that will be worth your time.